Now today we beam the searchlight on women's health, improving women's access to affordable, equitable and quality healthcare as a pathway to empowering the family. Now the idea is that if a woman has access to good health, then she is empowered to be productive and contribute economically to our family's growth, ensuring that the children have good health, the family is okay, proper education, shelter, and other social determinants of health. Now, with the help of Integrated Health USAID, my guest will throw more light on this. How can investing or investment in women's health contribute to reducing maternal mortality, improving reproductive health outcome, and promoting family planning in underserved areas or underserved communities? I'll start with Dr. Wamakko.
Thank you so much for giving me that question, because we are celebrating Women's Health Day worldwide, and FCT is inclusive.
Yes.
The way to improve women understanding and thinking is first by empowering them with education. The education gives them informed choice, informed notice that they're supposed to know on how to take care of themselves. How to take care of themselves health-wise, because health is wealth. Once you are healthy, and then you live a healthy environment, and once a woman is educated, you educate the society. So education is the first key for them to have an informed choice, and then you empower them in the issue of having something to do in hands, having some many things to do in hands for them to be able to get an income. Once a woman is having an income, the entire family is rich. The entire family is rich in the sense that she strategized to look after the family, from the decision makers in the family down to the children and everybody, and even the people around her and the society at large. For women to be empowered, we need to do a lot of social mobilization. Advocacy, communication, and social mobilization is key here to involve the stakeholders in the community, and also to involve the religious leaders, traditional rulers, women leaders, the youth, the boys and girls, and then even those in school and those out of school. Once you socially mobilize them, you involve them, and you give them key information that they're supposed to know, then you have empowered them. When you empower them like that, they know the importance of patronizing facility. Once they go to the facility, particularly if a woman is pregnant, that woman's supposed to understand that she's supposed to go and register for antenatal.
That's right.
After registering for antenatal, she's supposed to go, now that we are doing a group antenatal care as the WHO standard,
yes,
of 8 visits.
Okay.
She's supposed to at least engage herself in the facility for the complete 8 visit, and then she should also understand the importance of her to come and deliver in the facility.
Do you tackle mental issues? There's a lot of talk around mental health, especially when women are going through one or two things, for example, postpartum depression or issues that surround GBV. How do you take care of that aspect?
You can imagine when a woman is going through those trauma when they're pregnant, the mental trauma when pregnant,
exactly.
And those facilities are not, those options are not available for her, or probably she's not informed of those options.
Because it's one thing to be informed, it's another thing to be going through and know where to get help.
Know where to get help.
Yes, she needs support.
So this we're talking about family. I'm heading family in my secretariat. A woman and a husband supposed to work together, especially during pregnancy, so that she'll be able to live a healthy life. Sometimes there are mental torture in relationships between husband and wife. There are mental tortures because the man is not informed, the woman is not informed. That's why sensitization is very important, even with our men. Because if a woman have information and the man does not have, it will not make sense. The two of them cannot cohabit. Yes, they can't agree. So when this sensitization comes up, it's important for us to get our men involved. Not only the women. The man needs to hear what the woman is hearing, especially concerning her health. There's always a system, especially in my secretariat, of counseling, psychosocial support for such women. But the key is when they are empowered, because a woman that is empowered is different from that one that is dependent, solely
dependent
on her husband.
Let's talk about the health insurance in the FCT, Dr. Wamakko. How's that going? Are we seeing a lot of people embracing the health insurance scheme? Because that's actually one area that would improve our health.
Yes, that is what I wanted to say about, because when you talk of empowerment, you need to also look at empowerment in terms of health.
That's right.
Because when you are empowered in terms of health, then you are creating wealth for yourself. So FCT health insurance scheme, community FCT health insurance scheme has been inaugurated, has been commissioned few weeks ago.
Yes.
And then we are planning to come out on weekly or 2 weekly community sensitization, community by community across the 6 area council in the FCT, sensitizing women, sensitizing stakeholders to come and register in the community health insurance scheme, for them for us to see that we have get rid of out-of-pocket expenditure whenever there is health issues in terms of maternal and child health. So that people can no longer be spending from their pocket for them to access health. So health insurance scheme for FCT is planning for that. Our Monday Secretary has, in fact, yesterday I was in her office. We had a meeting. We discussed extensively about that. So it's going to be a kind of 2 weekly or 1 weekly sensitization in the community for them to come out and register. We want to use this opportunity to socially mobilize women and their spouses to understand that there is community health insurance, there is abundant resource there. They should please come out and register for that and have access to those funds so that they can have free or subsidized, highly subsidized healthcare services.
Thank you. Thank you, Dr. Wamakko. Very, 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 important information going out there. And as we begin to wrap up, let me go back to Madam Cynthia. For the Women Affairs Secretariat, she just talked about shelter in collaboration with your office. What other plans are you rolling out, especially from this month of March till the end of the year, that we should look out for, and probably give a summary as to how they have performed at the end of the year? What are we watching out for from your Secretariat?
Okay, for the shelter home, is a consign. According to the Monday Secretary Adedayo Benjamin Lani, she said it's not just a consign. This time around is a crime that she needs a shelter home. FCT needs a shelter home on its own. We only make use of the federal and the NGOs, which is not right. We really need a shelter home in FCT, and which she is already pushing up to the FCT minister. In fact, he has been a support to us. Even the empowerment for women, he has given a go-ahead for that, to empower women in FCT, which he has done. He's fully in support. The FCT minister is fully in support. Minister Wike, he's there for us. He's ready to support us. So even the shutdown, we're already pushing also, because the cases we are having, as of today, we have 3,499, and which
GBV-related cases.
Yes, we are under-reporting. We have thank you, ma. The strategy she is putting on ground right now, and concerning the data entry. I also talked with the officer from primary health care. We're mapping out strategies on how we can pull in our data on the national dashboard. They have a lot of data right out there. They are already putting it, reporting the cases to the dashboard. Also, other NGOs that are working in FCT, we have data all over. So that is why we put on ground the corpus posted to Women Affairs to go out there. We have trained them. They go out there to go and help report the data to the national dashboard, so we'll be able to analyze and know know what we'll be able to make decision on what we need to do.
Okay.
Without the data, we can't make any decision. We will not be able to
plan properly.
Yes. So this will help us.